Hi, I am Dr. Yashavanth, consultant gastroenterologist at Bangalore Institute of Digestive Sciences, Bangalore. Today I will be talking about management of fatty liver. You know, fatty liver is one of the common term you have heard of when you go for routine screening, ultrasound abdomen. You get a report saying there is a fatty liver. Depending on the grade, they might give grade 1, 2, 3. And often you are worried about the same. So you need not be worried, but you should know what is it and you should take appropriate steps. Why we should be considered about this is because it is one of the common causes of liver cirrhosis and transplant in the world. And also it increases the risk of cardiac diseases or cardiac risk related deaths. So it is important, we should know and we should tackle it. So how do we tackle it? What is the most important thing which will help? So if I want you to give one important thing is weight loss. Second important thing which will help is weight loss. Third important thing which will help is weight loss. Because that is the most important thing which will result in reversal of fatty liver and no medication even come close to it. So there are ways which we can approach to reduce the weight. So one is, the most common is diet and exercise. Then there are some medication which will help in reducing weight and also in fatty liver. Then we have endoscopic therapies or bariatric surgeries which helps in weight loss. Diet, we should importantly know how much quantity to take, what quality of diet to be taken and timing of diet. So coming to the quantity, so the diet should be deficit in a calorie of at least of around 500 to 1000 kilocalories. That is the first thing. And a regular adult will require somewhere between 1500 to 2200 kilocalories. It should be deficit of around at least 500 kilocalories. And coming to quality, this diet should be free from sugar or sweeteners, then reduced fried food, reduced high calorie diet and reduced processed food. And also in simple terms, anything which are packed and sealed should be avoided. Timing of diet, there are different methods which have been followed, but I personally advise, which has been there in Indian history or culture, is intermittent fasting, which will help us in reducing our weight and also in the central obesity. And other diets which are recommended is Mediterranean diet, which is also been proven in many of the studies. Then exercise at least of around 45 minutes to 1 hour per day, at least 5 days a week is recommended, which will helps in weight loss. And we should target at least minimum of 3 to 5% to reduce the amount of fat. If we go even beyond, it is better. If we go up to 7%, even the enzymes might become normal. If we achieve a 10% weight loss, even the fibrosis might get reversed. So 10% weight loss in a 60 kg individual will be a weight loss of around 6 kg, which is achievable, which will reduce or reverse the fibrosis in the liver. Then we have endoscopic therapies like endoscopic balloon placement in the stomach, which reduces the food quantity and thus causes the weight loss. We have endoscopic sleeve gastroplasty. It's called ESG, which was used to be done via surgery prior, where we reduce the stomach size and bring down the appetite and the food intake. Third one, which is a newer one, which is called duodenal mucosal resurfacing, where it is based on the concept of incretin and anti-incretin. So what we do is the duodenal mucosa is ablated, so it will regrow. When it regrows, the rebalance is achieved, which also reduces the insulin resistance and it also brings about change in fatty liver. And the last is surgery, which are restrictive surgeries or malabsorptive surgery, which bring down the weight loss and in turn bring down the change in fatty liver. So to conclude, it is the weight loss which is achieved by various mechanisms will result in reversal of fatty liver. There are some medications also, diabetic medication and medications which act directly on the liver might help us to reverse or reduce the severity of fatty liver. To know which stage you belong to and to know which is most appropriate therapy for you. And most of the patient can be managed with just lifestyle measures. Very few required a pharmacotherapy and other measures. So you can contact your nearest gastroenterologist to get appropriate treatment. Thank you.